We're going to start off with a story about Medicare.gov. How you doing today, Ari?
I'm doing great, Dr. Ed. How are you?
I bet you I'm doing way better than you, considering you and your team probably, 2, 3 hours of sleep during this annual enrollment period?
We're certainly in the thick of it. And
Yeah,
the
so
Dodgers going 18 innings the other night didn't help either.
is that crazy? Yeah, that was crazy. Yeah, that's like and they were in the clubhouse, and the coach says, hey, don't get too excited. We've got another game today because it went into the next day.
Right,
So
right.
yeah, I think they're tied 2-2 now, so it should be interesting. Hopefully, Freddie Freeman can do it all again like he did last year. But all right, I digress. All right, so we're in the middle of the annual enrollment period, which began October 15th, ends in December 7th. Whatever, you still have time. I have a lot of people. We have a lot of people in the community that reached out to Chapter, and Chapter is way inundated right now. And Ari, I think, has a request to if you called and you weren't able to get in, please try again. And any other recommendations on getting the best help you possibly can?
Absolutely. Have your 6 Ps ready. And the three, Dr. Ed, if you want to put it up, Dr. Ed came up with the 6 Ps. I only have
Seven,
three. Dr. Ed made it
seven
six.
P's now. 7 P's. I added prices on there. Yeah, so
Yeah,
we've got have your 7 P's ready. That makes everything so much easier. So for if you're shopping for a Medicare Advantage plan, if you're want a Medicare supplement plan, don't really need the 7 P's. You need some of those, but not the 7. But if you're looking to review your Medicare Advantage plan, then have your current plan available, and that way they can compare apples and apples. If you have a particular provider that you need, or providers, or hospital, make sure you have that information, your prescriptions, not only the name, but whether it's extended release and the milligrams and everything like that. That way they can
yes.
save you the most money on prescriptions. If you have a particular pharmacy you really like to use, or a mail-in
Mail order.
pharmacy or whatever, exactly your priorities. If you want more vision, dental, and I'll say prices. People say, well, they're all zero premium anyway, right? So it doesn't matter. Now, a lot of them are zero premium Medicare Advantage, but then you've got how much you spend for a hospital per night, $100 versus $500, MRIs, specialists, and everything.
Right.
And then for the other 364 days of the year, persistence. We got, I think it was a plant. Someone put a question in one of the comments that said, what are you talking about prior authorizations? Those are easy. They just, the doctor asks for a prior authorization and it's approved, that it's never denied. So I think a Medicare insurance agency got in there and made that comment, because a lot of people get denied on prior authorizations, correct?
Yeah, there were over 50 million prior authorization claims in 2023. And if your prior authorization claim gets denied, it's a process in order to appeal. And that's something our team will help you with. You're not only supported by the Medicare advisor that you work with, you're also supported by our member advocate team, which is your first line of defense for any hiccups that come up with your coverage throughout the year.
Exactly. That's it. I mean, there's a lot of places out there that can help you find a plan, but it's the other 364 days of the year that you're actually going to be, well, it's actually 365 days of the year that you're actually going to be using that plan starting January 1st. And if you're getting weird billing, you need to find a doctor, a specialist, you need help prior authorization, then Chapter is in your corner to help you out.
Right.
And I am in your corner to help you out with all things Social Security, retirement benefits, survivor benefits, spouse benefits, disability benefits. There was a big story, John Oliver, last week tonight on Medicare Advantage plan, and he did a really good job on it. He had mentioned that call your state ship to help you out. And from my personal experience, when I ran the Social Security Administration in my town, we used to send people down to SHIP all the time for that, and it just mixed reviews. They're volunteers. They're not really funded. They're losing. I think they're pretty much losing funding. I think all government agencies are losing funding, aren't they?
Yeah, have been many cuts, not to Social Security or to Medicare. They haven't touched those entitlement programs, but yes, there have certainly been substantial cuts to volunteer agencies like your local ship.
And I know personal examples of ship advisors who help out other people in the community find a plan for them. And then when it comes to their plan or their family's plan, they call someone that does it professionally. So that's kind of an indication that, they give out information to other people. They're volunteer. I'm never going to talk bad about volunteers. So, but if you want to make sure that, you really need to talk to a professional.
Yes. And these state health volunteer organizations are certainly well-intentioned. It comes down to a question of tooling, though. And the Washington Post had an exclusive piece on Medicare.gov's provider search. For the first time, Medicare.gov has launched provider search for Medicare Advantage plans. Here's the issue, though. Over the last 2 weeks, what people who have tried using Medicare.gov's provider search have noticed that there's duplicate locations. So which address do they pick for their doctor, right? If your doctor practices at 8, sometimes a dozen locations, and you see duplicate addresses, what happens when that very same address shows in network, but out of network at it? Which one is source of truth? And that is something that that is a problem that our team has a solution to. We have built our own platform that shows whether your doctor is in or out of network. Of course, we're using the provider search information that the insurance companies give to us and that they give to Medicare. But we're also adding our own secret sauce in order to avoid that duplication issue. And you need to make sure, if you choose Medicare Advantage, that your doctor is in network at the location where you see them. This is critical. Even if your doctor shows as in network, if they're out of network at the location where you see them, then they're out of network. And you're going to pay more if you're even allowed to see them at all.
Yeah, I think that's one of the things that John Oliver talked about in that story, is that the physician was covered, but the facility the physician saw the person in wasn't covered.
Yes.
And then there's a situation I've heard where people go in for surgery and the surgeon is covered, but the anesthesiologist that they bring in isn't covered. So something needs to be done about the entire thing. I know the chapter management team, the ownership team goes to Washington, D.C. quite often and tries to fix this. So definitely keep working on that front as well. If y'all ever need any, crowdsourcing for reaching out to politicians and saying, hey, this needs to be changed, this needs to be changed. We have the best community on the internet, on social media. So definitely reach out to us. Let's see. Max spoke to Ann at Chapter. She helped me get back to Original Medicare. Perfect service. Okay, good deal. We like to hear it. So what are we talking about?
That's what this time is for right now. So during the annual enrollment period, you can do 3 things. First, you can go from Medicare Advantage back to Original Medicare. And if you go back to Original Medicare, then you would want to make sure that you have coverage for the other 20% you're going to owe out of pocket with no limit on your 20%. So there, you would want to consider a Medicare supplement plan and a standalone prescription drug plan. The second thing you can do is shop your Medicare Advantage plan. Make sure you do this every year. And the other thing, the third and final thing you can do, is optimize your standalone prescription drug plan or sign up for one for the first time.
Perfect. Yeah, so now until December 7th, and the new plan won't start until January 1st, so we still have time. Let's see here. Yep. Hey, Bella, how you doing today? She just got out of the hospital. She was in a hospital for a few days, and now she's back. She's back to her old awesome self. Welcome back, Bella. So someone, let's see, a few people said they called Chapter and they weren't able to get through. Any recommendations on that, best times to call? Because I know you told us last time y'all are open from 8 to 10 East Coast time, Monday through Friday, and Saturday and Sunday from 9 to 9.
That's right.
Yep.
Those are our hours, and we're worth the wait. So if you call in, yes, there will likely be a wait, especially in the early afternoon. We're going to do our best to get back to you before the end of the day. If we don't get back to you before the end of the day, we'll probably get back to you by the next business day. Persistence and patience are key. You have until December 7th. So even if you're not able to optimize your coverage today, we can help you at any point until December 7th at the stroke of midnight. That's when, and oftentimes we're up until Hawaii until Hawaii hits midnight on December.
Right.
December 7th is the longest day of the year for us.
Okay. Yeah. Don't definitely don't call don't wait till December 7th. I think Ari recommends calling on the Marine Corps birthday, which is appropriate. Old Marine Corps sergeant here, November 10th. Things might slow down a little bit. So
yes,
the Marine Corps birthday, November 10th, or Veterans Day, you're still going to be working on Veterans Day, November 11th, right?
Yes, we are. So the first 2 weeks are often crazy. And then the last week, the week following Thanksgiving, right? Because that's when the procrastinators come out of the woodwork. And I don't mean that in a derogatory way as a fellow procrastinator myself. Yeah. That's you. If you call sometime in November, that's a great time for us to talk about your coverage. Dr. Ed suggested November 10th. Put it on your calendars. That can be Medicare Review Week, the week of November 10th.
All right. We might have to do a special episode on that, maybe Veterans Day or Marine Corps Veterans Day episode. Yeah, and we'll reach out to as many veterans and give them help on all things Social Security and Medicare and all the rest of it. A lot of veterans always wonder about, I've got the VA, should I even sign up for Part A, Part B? What do you say to that for those veterans out there? And 99.9% of the time, they just don't want to pay the extra $185 a month or whatever it's going to be for next year. If they're relatively happy with their VA, what do you recommend for them?
So for veterans, if you go to the VA for 100% of your care, if there's a VA facility near you and you're comfortable receiving all your care then at that location or at a VA facility nearby, then yes, you technically do not have to sign up for Part B, and you would save the $185 per month charge for Medicare Part B. But the downside would be if you change your mind later on and you decide to go to a private doctor who isn't part of the VA, then you would probably want Medicare Part B at that point, and you may owe a late enrollment penalty for Medicare Part B. There's also a special subset of plans for veterans called Medicare Advantage only plans. Oftentimes these plans have more generous additional benefits. Still, we would need to make sure that the doctors that you want to see are in network with that plan and that it covers the additional benefits that you're interested in, oftentimes dentistry, for example.
Yeah, one of the things I always add on that, if you're happy with the VA right now, but the situation changes. If you move and you're no longer near a VA facility, and VA has announced they were trying to cut back 85,000 jobs, but a lot of people, including people in our community, reached out and said, yeah, no, don't even try it. So now they're working it through attrition. So now they're looking to reduce VA staffing by about 35,000. And that's going to hurt a lot of VA facilities throughout the country. So you might be happy with the VA now, but is that always going to be the case? So it's always good to have a backup. And as I always say, all the veterans out there, do you have to have Medicare Part B? No, you don't have to do, as our drill instructors used to tell us, no, you don't have to do anything in life. But if you don't, the repercussions are the penalty. So
right.
If you decide not to sign up for, if you decide not to sign up for Part B when you're first entitled at 65 or being on, disability for 24 months, then you're not penalized. You're penalized when you change your mind later, or life changes your mind for you when your situation changes, and then you have to sign up for Part B. Then you're penalized 10% for every 12 months you did not have Part B when you were supposed to. So, and that's forever.
And I was helping a vet last week who they were 71 years old and they didn't start Part B when they turned 65. And because they've gone a full 5 years without Medicare Part B, they're going to owe a 50% late enrollment penalty. And now they do want to see private doctors. They want to go outside the VA, but they're going to owe a lifetime late enrollment penalty for Medicare Part B. So it's highly consequential, the decision whether as a vet to take Part B or not. And many, many vets choose to pay the Part B premium.
Or there's another option out there, the Part B give back plans. If there's one available in your area, it pays, what type of trends do you see for 2026? Do you see anything that you notice of those are continuing, or what it basically is the health insurance company, the Medicare Advantage plan you sign up for, pays for part of your Part B, $50, $100, $150, maybe all of it, depending on what's available in your area.